there's certain questions that come up and that are routine for various procedures. Of course, depending on the procedure, those standard questions, those those frequently asked questions are pretty similar. Um, One of the ones that is really kind of universal for adults, at the very least, is when can I return to work? And I definitely don't have, and obviously that's procedure dependent, but it's also work and lifestyle dependent. And I generally don't have, an answer, a direct answer for that, other than, that we provide whatever uh, resources are needed or notes that are needed if you're unable to work, proper excuses and filling out paperwork and whatnot. The reason I can't give that answer is because it's such a wide array and it depends on patients and their expectations and what they're able to do. An example would be if someone is having carpal tunnel surgery and their question is, when can I return to work? And some patients I've had literally return to work the next day. Obviously, they have a desk job, but sometimes that's not the case, even though I don't recommend going back to a labor job right after carpal tunnel. But so that's kind of one extreme. The other extreme is that, after several weeks of therapy and whatnot, that then they return to work. And it varies based on the demands at work and ultimately your comfort level in returning to work. So there's a lot of factors. Another one of those common questions is when can I drive after surgery? And that's kind of a loaded question because there are a lot of liability issues involved that I don't necessarily um, have a grasp on all of those, other than the fact that you definitely have to use your judgment with that and consider things like, of course, you can drive with one hand, but in an emergency situation, if you have to grab the wheel, are you going to re-injure yourself? Are you able to grab the wheel? Do you have the range of motion or strength? And so these are the types of things that would come up if you were in any kind of accident or anything like that. And so that's one of the reasons I can't totally advise that. I mean, in many cases, I give my recommendation and say, well, it probably is not a good idea. I think in many cases, patients may or may not listen to that advice. But specifically, I don't give a specific release to drive or restriction to not drive unless it's like kind of a work thing. Um, and so it's not kind of cut and dry. I definitely uh, rely on patients using their judgment, and more than likely, I guess the judgment would be if you have a splint or a cast or anything like that on, basically how would it look if you got into some kind of accident? Can you really say that you were 100% able to control the vehicle? So those are the factors. But again, I'm not going to specifically give a detailed note on exactly your driving ability. So those are two questions that come up all the time, and it's pretty universal, regardless of what kind of procedure, whether it be a quick outpatient thing or inpatient type procedure. This comes up most frequently.